And it was somebody who they had waiting down in the entryway into the hospital. And they asked me to come down and see, and I was at that time, I think, heading infectious diseases at the Pacific Medical Center as a youngster. And this was a guy who appeared to be quite sick, although he was, standing and dressed and had just walked in. But as he began explaining to me what his symptoms were, and I've long since forgotten what the symptoms were, and what his, and he was talked about sexual contacts with MSM, and I can't remember if he had remembered or had already heard about HIV or not, but as a result of seeing him there, never having seen anybody with HIV before that, I got together with him in my car, and we drove over to Harborview, where we had set up a bigger STD clinic. We'd had a small one at the public health hospital already by then. And so we went in there, and sure enough, he had, I've forgotten how we defined it, but he had AIDS and HIV and was quite sick. And became sicker as time went on. So that was the first patient I saw. I can't remember his name, but he was, his symptoms, whatever they were, in retrospect, I forgot it, but he was feeling fairly sick. I think he was probably, febrile and a bit confused, as I recall. So that was the timing, anyway, of when I saw the first patient. The early days went on for quite a few months and even years, but the number of patients kept going up. I had already set up an STD clinic, or was in the process of setting the STD clinic up at Harborview. And as I recall, at that time, I was beginning to go back and forth. And so we didn't know that there was going to be such a big epidemic of HIV, but this was the first I had seen, and it became obvious we needed to begin thinking about how we would prepare for that. And so I began spending more time over at Harborview at the STD clinic that we had set up. And that became an area where we began to focus our care not only for STDs, but for HIV. It became obvious fairly quickly that this was going to be a big deal. The governor at the time convened a group, and I'll have to think a little bit about, it was, does Booth Gardner sound right? I think he may have been the governor. But we were beginning to see so many patients with HIV coming into our STD clinic that lots of people became aware of it and interested. The university became interested and concerned. There had been I think it was a dentist working in Florida who had somehow become infected, as I recall, from a patient with HIV and passed HIV on to another patient. So all of a sudden, the university wanted to paralyze everything we were doing with HIV. And we were able to get them to just let us use good medical care and not panic.